What's it actually like to live with sleep apnea day to day?
Yeah, it's one thing to understand the science behind it, but it's a whole other thing to actually deal with it in your daily life.
Exactly.
Where do you want to start?
Well, I think a good place to start is with CPAP therapy, since that's often the go-to treatment for moderate to severe OSA.
Makes sense. CPAP is super effective, but it definitely takes some getting used to.
Yeah, for sure. I've heard from a lot of people who say that they struggled with it at first, feeling claustrophobic with the mask, dealing with dryness, or even just the noise of the machine.
Those are all really common complaints, and it's understandable. It's a big adjustment to have to wear a mask and have air blowing into your nose all night.
Right. It's not exactly the most natural way to sleep.
Yeah.
So, what advice do you have for folks who are hitting those roadblocks?
Well, first of all, I want to say that it's totally normal to feel that way. You're not alone. A lot of people struggle with CPAP at first. The key is to not give up and to work with your doctor or sleep specialist to find solutions that work for you.
So, it's all about finding that perfect fit.
Exactly. There are so many different types of masks available these days, from nasal pillows to full face masks. It's all about finding the one that feels most comfortable for you.
And what about the dryness? I imagine that can be super annoying.
Yeah, dryness is a really common side effect of CPAP therapy, but luckily there's an easy fix for that.
Oh, what's that?
Most CPAP machines come with a humidifier that adds moisture to the air that's being blown into your nose. And if that's not enough, you can also try using a saline nasal spray, or even just putting a little bit of Vaseline inside your nostrils.
Okay, cool. So, dryness doesn't have to be a deal breaker.
Nope. And another thing that can help with the overall comfort of CPAP therapy is to make sure you're using the right settings.
Oh, yeah, that makes sense.
The air pressure needs to be just right to keep your airway open, but not so high that it feels uncomfortable. So it's important to work with your sleep specialist to make sure your CPAP machine is dialed in perfectly for you.
Okay, so we've talked about masks and dryness and settings. What about the noise? Is there anything people can do about that?
Yeah, some CPAP machines are definitely quieter than others. So if noise is a major concern for you, you might want to ask your doctor about getting a newer model.
And what about earplugs? Would those help?
They could for sure.
Hmm.
Some people find that earplugs or even white noise machines help to block out the sound of the CPAP machine.
Okay, cool. So there are definitely ways to make CPAP therapy more tolerable.
Totally. It might take a little bit of trial and error, but most people are able to find a way to make it work for them.
And I imagine the benefits are worth it, right?
Absolutely. When you're using CPAP therapy correctly, you're getting that good quality sleep that you need to feel your best.
Right. It can make a huge difference in your energy levels, your mood, your overall health.
Exactly.